12 deaths in the last 24 hours, and again my condolence goes out to the family and friends of those individuals. Sadly, their ages range from their 30s through to their 90s. We had none of those people had received a booster. 3 were unvaccinated and 9 of the 12 were aged care residents. And I'll talk a little bit more about the aged care residents in a moment. In relation to our hospitals, we remain at 663 public patients and 42 in ICU, 22 of those are ventilated. Again, we will expect as we go through the week more of those people be discharged, and we've had 42 recorded in private hospitals and 3 in ICU, which is good news to see that the numbers in private hospitals is coming down as well. Our vaccination rates at 92.19% and 89.97%. We are nudging close, very, very slowly, closer to that 90% double dose. As I said yesterday, if you are due for your second dose, you can help us get to that 90% quickly by coming out and getting vaccinated straight away. Our 12 to 15-year-olds is still sitting at 68.79% double dose. Our 5 to 11-year-olds are now at 39.46%, and our boosters at 58.51%. So again, you know, keep coming out and getting vaccinated. I saw reports today that Novavax has arrived in the country. That is due to be provided from the 21st of February. There are discussions at the moment with the Commonwealth as to who will be provided with that Novavax. It is our preferred position that that will go to community pharmacies initially and to GPs, just as Moderna has now, so that we can make this more business as usual as the vaccination program continues to roll out across the state. I can report in relation to school-age children, so as a baseline of knowing with school going back, how many 5 to 17-year-olds are showing up positive. Now this is at the moment just PCR tests, not rapid antigen tests. We are looking at that data at the moment, but in the last 24 hours we've had 313 children between the age of 5 and 17 who are positive. Now these will be children who were infected before school went back, so this will be a good baseline for us to monitor going forward whether we see a significant increase. We do have 11 children between the ages of 5 and 17 currently in hospital, but in the data that I've been shown overnight, we have seen a quite significant decline in the number of positive cases of 5 to 17-year-olds from 4 weeks ago up to a week ago. And what that shows is that we have had big infection, large infection across our young people. That really reflects what we've seen in the broader population, and that those numbers are coming down. Again, I remind people we do expect outbreaks to occur with children going back to school, but it is promising to see that we've had those children already going through a bit of a peak themselves prior to school coming back, and we're pleased to see those numbers. Just on the deaths, I did report yesterday that I'd indicate how many First Nations people have passed away who have tested positive with COVID, and we've had 11 First Nations people who have passed away since we opened the borders. We had none before then, but I think, you know, the statistics of 11 out of what we have recorded at the moment, we know our actual cases are far greater than what's reported, is 16,256 First Nations people being positive, and only 11 deaths so far. Now, those 11 deaths obviously are tragic, but I'm pleased to see that we are not seeing a disproportionate number of First Nations people passing away from this virus at the current time, but we are still seeing low vaccination rates in some of our First Nations communities. So I encourage, again, our First Nations people to come forward. Doing a bit of an analysis of our aged care residents who have passed away, who have been tested positive for COVID. Of the 160 deaths so far, only 9 had a booster, 21% were not vaccinated at all. 55% had had 2 doses, 6% 1 dose, and we have 9% that is unknown. So they may have asked for their immunisation record to be sealed, and so we're not aware of what that 9% are. So I do want to once again remind people to go and get vaccinated. We have capacity at our testing clinics. If you cannot access a rapid antigen test and you have symptoms, or you are requiring a test because you're a close contact and needing that day 6 test, you can come forward for a PCR or possibly getting that rapid antigen test at one of our clinics. But I am pleased to see that there are more rapid antigen tests starting to become available in the private sector, in our pharmacies and supermarkets as well. And it's great to see that our number of staff is declining even more that are quarantined and isolated, and we're down to 2,305 today, which is great news as well. I'll now hand over to Dr. Gerard. Thank you.
Thank you very much, Minister. So sadly, we have 12 deaths to report today. One person in their 30s. I have to say this was a somewhat unusual case, and it's not clear to what extent COVID played a part in this person's death, but it could have played a part. So we include this case for the sake of transparency. There were 2 people in their 60s, 2 in their 70s, 3 in their 80s, and 4 in their 90s. 3 of these people were not vaccinated. 1 had had a booster. 6 had had 2 doses. We don't have the status of 2 of the 12, but of those 10 that we know, none had received a booster. And 9 of the 12 were known to be aged care residents, bringing the total of number of deaths in aged care in Queensland to 160. In terms of hospital care, we're still at 663 inpatients in public hospitals, and as I mention every week, I think this is part of the 7-day cyclical phenomenon that we see in all hospitals, that the discharges are slow. What the numbers we see actually reflect what has happened over the weekend. So discharges start off slowly and they accelerate during the course of the week. So we will expect to see numbers to fall later on in the week, and this is typically the pattern we've seen all the way along, and it's typical of what happens in all hospitals. This includes 42 patients in ICU, 22 of whom ventilated. In the private hospitals, the number has declined to 42 patients in the last reporting period, down from 61 yesterday. As the Minister has mentioned, we are starting to collect data on school-aged children, just to get some sense of what is happening there as schools return. So there are currently 11 children in hospital with COVID-19. These are 7 children aged 5 to 11 and 4 children aged 12 to 17. Now, most, if not all of these, will be in hospital for a reason other than COVID. So if they have appendicitis and happen to test positive, they will be included in those data. But it will give us some idea of what impact the return of schools has had. So this is a baseline. And there are 100, in terms of positive PCR tests in the last 24 hours, there are 158 positives. There were 158 positive PCR tests in those aged 5 to 11 and 155 positive PCRs in children aged 12 to 17. And this will act as a good baseline. When we were doing this analysis over the last 24 hours, we noted there was quite a substantial wave of infection in children that coincided with the wave of infection in young adults that occurred sort of 3 or 4 weeks ago. You might recall that lots of young people in their 20s were infected about 3 or so weeks ago. And when we looked more closely at children, a lot of those were also infected at that time as well. And there's been a substantial decline in the number of children infected in the last 3 weeks. So what level of immunity that will have created in children as they go back to school is yet to be seen. But we still expect there will be a rise in cases in the coming weeks. But it will be interesting to see what happens, and we'll be sharing the data as it arrives with us. And just to clarify something the Minister said, just to be absolutely clear, with regard to boosters in aged care, it's 9% of those in aged care have received. 9% of the 160 people who have died in aged care had received boosters. Not 9 individuals, 9%. they were vaccinated, but it wasn't the case wasn't totally straightforward. So it involved it involved a blood clot, and we know that blood clots can occur in anyone, and there are various risk factors for blood clots. This particular individual had COVID-19 and a blood clot. Whether the COVID-19 was the cause of the blood clot or contributed to the blood clot, that's where it becomes complex, and that's why we've included this case in the data.
We're all talking about how winter could be a different wave. You're a little bit worried about winter. I know besides the temperature, what's going to be the big difference? And a lot of people got it in summer, which is a blessing in disguise. What do you foresee happening in the winter, and why will it be so different?
Well, look, the reality is we don't know. So this is the big mystery, and we're all waiting to see what will happen. Clearly there has been a substantial wall of immunity that has developed in the community through a combination of vaccine-spreading group of people in their 20s, and I'm sure that will create a significant protection going into winter. So whether there will be a substantial secondary wave in winter or not is unclear. Why exactly this virus is more associated with cooler temperatures is not clear, but epidemiologically we know that is the case. But the protection that will be afforded by this wall of immunity, because there is clearly substantial immunity developing in the Queensland community, both through vaccination and in natural infection.
Is it a matter of time until we see another strain, do you think, from overseas, and with our borders open? I know it's welcome back to tourists and stuff, but are you a little bit worried there might be another strain?
It's always a possibility, but I'm a glass half full kind of person. I think that I'm very heartened by the level of immunity that we now have in our community. Now, but of course, anything could happen. It's pure speculation about the development of a new strain. I mean, this is what they call a single-stranded RNA virus. These viruses mutate naturally; they change, they alter, and our level of immunity to one particular strain will change over time. Whether that leads to a substantial, severe secondary wave, we just don't know.
The testing numbers at the moment in terms of PCR are quite low. For a while we went through a stage where we encouraged more people to get tested. I mean, beyond that need, or would you still like to see those PCR tests increase? I think that might be, in my memory, the first time we've seen the rapid antigen tests outweigh those positive PCR tests.
I think I would particularly like to see, certainly in the next few weeks, testing in children, where we have substantial capacity in the public health system for testing at our clinics for children. It is the gold standard test, and we really do want to understand what's going on in children. So yes, I would like to see children get PCR tested. I think, yes, they still need to get tested, and the rat testing would be adequate because of the need to isolate and quarantine the people immediately around them. So we have now just 3 measures in place in Queensland. Our measures have been pulled right back. We just have 3 measures that remain. That is indoor mask wearing, the necessity for vaccination in particular settings, and isolation and quarantine. Those are the only 3 major impositions now on the Queensland population that is any different to normal life in Queensland. So for the time being, those three measures will continue. So indoor mask wearing, vaccination requirements in particular venues like pubs, clubs, stadiums, etc., and isolation and quarantine of those who are positive. So yes, anyone who has a scratchy throat, a rat test for the most people will be fine. They should become increasingly available through retail outlets, I think, in the coming weeks.
What do you think the threshold will be to the point where we just accept that you have a scratchy throat and runny nose, you deal with it, you don't need to test and you don't need to?
That direction will ultimately come from the AHPPC. At the moment, the strong recommendation of the AHPPC is to identify cases, to isolate and quarantine for the time being. Now, whether that will alter in the coming months, that's to be seen. Their family members boosted. You're talking about older family members. I'm not totally sure. We don't really know why some older people are not being boosted. I mean, first of all, I would say that 70% plus of the greater than 70-year-old age group have been boosted. So most people over the age of 70 have been boosted. There is this small group, this 30% group that has not yet been boosted, both in residential aged care and some outside residential aged care. And it's not totally clear to me, and we're exploring that now, why this group has not yet been boosted. But we are still boosting them, so there are still people coming forward, but it is slow. And we know that it's critical. At this stage, we're not having an active discussion to remove that at this stage, not until we're very clear where this epidemic is going, because we don't yet know where this epidemic is going.
Minister, do we have a booster reluctance problem in Queensland? If so, how do we fix it? Or is it just a matter of timing at the moment, Minister, because people aren't actually due for it? What's your thoughts?
Well, interestingly, our booster numbers are doing better than most jurisdictions. It's our other vaccinations that aren't. It's the remainder of the population who haven't come out and even got a first dose. And we know we're talking, less than 8% now, but other jurisdictions are 95 plus. I'm hoping with the arrival of Novavax, that there are people out there who've been waiting with another option that might just get us that over 95% where we'd like to see it. The second dose, it's hard to understand why people wouldn't come out and get their second dose as soon as it's available, but it's, as we know, crept up so slowly. We suspect it's in that we know it's in the 20 to 40-year-old age group. They're the ones who have a lower second dose vaccination rate at the moment. We assume that's because there was a lot of virus going around and a lot of them infected, and so they held off getting their vaccination. But as we've said before, there's no reason, once your symptoms have passed, there's no reason to not come out and get your second jab. But our boosters are doing okay. Obviously, we'd like to see everyone in aged care with a booster, everyone who is over the age of 60, for that matter, to prioritise getting a booster. Our overall population number of booster is good, but particularly, and Dr. Gerard has just said, we're 70% for our seniors, for 70 plus, but we are well over 95% of that cohort who have had a second dose, 95. So, and all of those people, I would think a large portion of those people, I think were all vaccinated before we opened up at the 80% mark. We were already at that level. So there's no reason why that 70 plus cohort, that extra 25%, aren't rushing out to get boosted now. Look, I'm optimistic. I hope everyone's seeing the impact that not getting that booster can have when you're elderly. We do know, we've said from day one, that this is a virus that does particularly attack the elderly, and it significantly increases the risk factor. So, no, I don't know the reason why people haven't come out in that older age group, but I'm still optimistic that they will continue to do so. And I strongly encourage family members to talk to their parents and grandparents and encourage them, and even making sure, assisting them, making a booking at a pharmacy or a GP if they're concerned, or helping take them in as a walk-in to one of our vaccination clinics. Yeah, look, certainly, those things have been big incentives to boost our vaccination rate here in Queensland. We know that. That's why we did it, and to help slow down the virus. It's hard to know what else to do to encourage people. So many people said to me late last year, look, I'll eventually get it. When the virus starts spreading, of course I'll go out and get vaccinated. But we're not seeing that at the rate I'd like to. And we know the difference the booster makes. Omicron and the booster go hand in hand. Get the booster, you are much less likely to end up seriously ill and in hospital and in ICU if you've had that booster. So We'll continue to look at other ways to educate the community and what else we can do to encourage people to come forward. But I strongly encourage family members to have that conversation.
Do the feds count, Minister? Do the feds count? I think they're saying we're at 90%.
Oh, they like rounding up. But it's their own report. It's their own report that you only need to scroll down 3 more pages and you'll see that we haven't hit 90% in their own.
We give them our numbers at the end of the day or something? Is that
It's all taken off the Australian Immunisation Register. So it's their own data, which is why on the odd occasion the Prime Minister has gone out and announced our numbers before we got to, because they see that data before we do. But yeah, they tend to round it up, but their own report says we're not quite there yet. Crossing fingers, tomorrow will be a good day. We'll hit 90% hopefully. No. No, look, we know this is going to be good for our economy. We know we need to be moving towards, taking those steps of opening up. We've done it domestically. Now we need to do more of that internationally. This will be very much welcomed, and we've seen the comments overnight by the tourism sector. This is great for Queenslanders. And if unvaccinated, I know one of the requirements is to be vaccinated, but we'll still see exemptions being given, I'm sure, of unvaccinated people as well. But there are also people who arrive and will test positive almost immediately, and they will need to quarantine. So that's the benefit of WellCamp. We're still going to have a facility. If more and more people are coming in, inevitably a number of those will either have vaccination that's not recognised by TGA and will need to quarantine, or test positive on arrival and will need to go into isolation. And I'm so pleased we've got the facility to be able to facilitate that. But it is the next step we have to take. And as the Chief Health Officer just said, we have very, very few restrictions now here in Queensland, and it's because of the great work that everyone's done. No, we would not be taking rapid antigen tests off aged care to give to schools. It is the Commonwealth that are supplying rapid antigen tests out of their national medical stockpile for aged care. We have provided them where the Commonwealth has asked us to urgently step in and provide them, and then the Commonwealth eventually reimburses us with that supply, but we are not taking them off aged care. We are concerned about the aged care system, and I've been talking about that for some time now. The opposition did it when they were in government. Of course it is a good idea, and I met with the Integrity Commissioner and the Deputy Integrity Commissioner. I discussed who I was going to put on that panel. I discussed my reasoning. I got their endorsement, and they deemed it appropriate to do so. You can't engage the Legal Services Commissioner, you can't appoint a Legal Services Commissioner with a panel who have no idea or no knowledge of what that role is. The Bar Association and the Law Society are also the same bodies that we consult as to who should sit on our Supreme Court and our District Court and our Magistrates Court. And yes, they appear before those people after they're appointed, but we respect their ability to give an independent, unbiased view as to the best people for those jobs, because they understand that. Also, the Queensland Law Society has their own powers of investigation, similar to the Legal Services Commission. They perform that role under statute already. So, it is a bit of a furphy. This matter was dealt with in 2019. I said in 2019 that I got advice of the Integrity Commissioner. I acted on that advice. So the criticism, honestly, towards me in making that decision is that I followed the advice of the Integrity Commissioner. I can cope with that criticism. I did the right thing. I followed the advice. The panel I put together was an appropriate panel for consideration of such a significant appointment. Not at all. I believe they will look at Queensland and actually be amazed at the low numbers of COVID that we have had in this state since the start of the pandemic. The low hospitalisation rates, how well we have managed this, and know that they are coming into a state that knows how to manage a pandemic, that is keeping the community safe, and knows that Queensland is the best state in Australia to visit to holiday. Why would they want to go anywhere else, honestly? Look at Queensland.
Can I just make one very brief COVID clarification? I did say my preference would... Sorry, thank you. Minor clarification. I did say that my preference would be for children to be tested with PCR, but if parents do choose to test using RAT tests, then as long as the main thing is to register them on the Queensland Health website so we can track those cases. Okay, so you can do it either way. My preference is PCR, but RAT tests are okay as well, as long as you register them on the Queensland Health website. Thank you very much.